Hello, and in today's video we will be continuing the CBD education and looking at the top 5 reasons as to why most people may have failed CBD and why it may not have helped them. And after watching this video, you may want to ask yourself whether or not any of this pertains to you and why you might want to consider trying CBD again to see if it works after everything that you've learned. So stay tuned. So hello and welcome. If you're new here, if you're not, welcome back. I am Dr. Jack. I'm a board certified anesthesiologist and pain management physician. And I've been continuing this series of basically CBD education. And today I want to bring to you the top 5 reasons that I see clinically in my practice as to why most people failed CBD. The purpose of this channel is to help you live a healthier, happier, and more relaxed life through knowledge. And so if that interests you, please hit the subscribe button, and I would really appreciate an early like. It really helps promote the YouTube algorithm and pushing the videos out to a bigger audience. So much obliged. So without further ado, let's just jump straight into reason number 1. So reason number 1 has to do with expectations. And what exactly were your expectations when you started taking CBD? And clinically, I see a lot of patients that come to me and they tell me that, yeah, it just didn't work for me. And me being a pain management doctor, they say that, I still hurt and it just didn't do anything for me. And I end up asking them what exactly was their expectation to begin with. And believe it or not, some of them expect CBD to basically eliminate all their pain. And truth be told, I don't think there's even a powerful pharmaceutical product that can do everything that they are expecting, and their expectations are just a little bit too high as to what anything will do for them. And so one of the first questions that I always ask patients is to basically sit down and ask themselves, are their expectations too high, and what were they expecting from the beginning? And for that fact, I have also had patients come to me and tell me that CBD just didn't help them, or heard of other people say this. And when I asked them what were they exactly taking it for, and they couldn't really give me a reason. And so again, that's like taking Tylenol or ibuprofen and not having pain. And so you have to have certain metrics that you are looking at when you begin to take CBD, so that you are realistic in expectations and so that you can journal it and follow it along and give it time to see whether or not it has any effect for you and if it helped you. The next question you should ask yourself is whether or not you tried a reputable product. And if you bought your CBD from a gas station, let's say, and didn't do the research, do you really know how much CBD was in there? Did it match the bottle? In my previous videos, I talked about how there were studies done to show anywhere from 70 to 91% of the time the labeling does not match what is actually inside of the bottle if you actually do a lab analysis on the bottle. And so it is extremely important as to why you should completely do your research on what you were trying at the time, and whether or not you think that it was a reliable company that made the CBD within the bottle. And I will reference above as well as below videos that I have done that are pertinent to this entire conversation. I have had situations where patients tell me that they tried CBD and it didn't work for them, and I asked them on the next visit to bring in their bottle of CBD. And I specifically remember one patient that brought the bottle in, and it looks like someone just took that bottle and went to a swamp and just dipped it in there and put it on a shelf and sold it. It was very green looking, and there were even particles floating inside of it. I mean, just looking at it, it just looked very unappetizing, and I cannot believe that this individual was actually putting it into their body. And so, if you're purchasing a very high quality, clean product, I mean, it should look almost clear and like water in some circumstances. This is why making sure that there is a third-party certificate of analysis, or COA, is extremely important. And again, all of this is covered in a past video, and if you want to know more, I really suggest you go and watch that video. So this is a very important topic. Did you give the CBD time to work within your body's own endocannabinoid system, your body's own cannabis system? And it takes anywhere from several weeks sometimes up to studies showing anywhere from 1 to 3 months before people start to see the effects of CBD. And so I've also had patients come to me and say, yeah, I tried CBD, I took it for a couple days and it really didn't do anything for me, so I stopped it. Well, I mean, that's not really giving it a chance per se. And if you're taking it for something like insomnia, I have seen it work typically within the first time that you take it at night for things like insomnia. But for things like anxiety, mood, pain, inflammation, and a whole host of other issues, it really does take weeks, if not months, to work. And so one of the most common pitfalls that I see people saying that CBD did not help them is that they did not really give it enough time for it to work. And I asked them to keep in mind that basically this is not a powerful pharmaceutical drug, that the first dose is extremely powerful and is fraught with a ton of side effects. If you think about it, this is a very holistic treatment, and like most holistic treatments, it does take time for it to kind of build up and work for you. But slow and steady truly does win the race, and if it does help you, and once it does help you, the relief, it's a much cleaner, less side effect way of obtaining that relief, as opposed to taking a very powerful pharmaceutical drug that basically throws your bodies completely off of balance. And that is exactly what CBD does, is basically bring homeostasis back into your body, or bring a balance back to your body. One of the things that I tell patients is to keep a journal when you start taking CBD. And I think it's extremely important because it works for some people quite subtly. And you may not exactly pick up on it. And the biggest things I tell people to do is basically journal things such as your sleep, your mood, your anxiety, your pain, morning stiffness in regards to inflammation and arthritis, or whatever it is exactly that they're taking it for, whether it's restless leg syndrome or migraines, and to just kind of journal how much, when they started, how much they started taking, and for what period of time, and to document on a daily basis, just sort of a self-assessment, and asking themselves, okay, well, how do I feel about this today? Is it decreasing in intensity or frequency? And all of this is important to chart over a period of time to see if you need to adjust the dosage or give it more time. One other thing I do want to call to your attention that I've noticed clinically is that if you abuse tobacco and if you are a regular habitual marijuana user, I have seen that clinically it takes much longer and at a much higher dosage for CBD to work for those individuals. So if you're using marijuana, what I normally suggest is just completely abstain and no longer use it for about a week or so, and then start taking CBD. And hopefully that will help decrease the tolerance. And for tobacco abuse, I'm going to do a whole separate video on tobacco abuse and what it does to your body. And it's very, very hard to get CBD to help with really anything for someone that abuses tobacco. So please, please, please consider quitting tobacco abuse just for your overall health. So naturally, after asking yourself if you gave it enough time for it to work, the other question to ask yourself is, did you take the right dose? And if you watch my other videos, dosing of CBD is quite complicated. It's actually one of the frustrating things about it, because your endocannabinoid system as well as mine are very different, and so many things can affect this. And the fact of the matter is that based on your height, your age, your weight, your genetics, as well as what ailment you are trying to take it for, the chronicity or how long it's been going on for, as well as how severe it is, all of it affects the dosage. Again, I will link above and below my previous video that I did where I talk about appropriate dosing to help you get started. But Basically, it's anywhere from a 1 to 6 milligram per 10 pounds, and it really depends on the severity and all those other factors that I talked about as to what end of the spectrum that you should basically start at. The other question I get asked a lot is, okay, well, how long do I take it for before I increase the dosage to see if there's any new effect? And I normally tell people to give it at least 1 to 2 weeks minimum, and to keep that journal and to document the effects and see if there's any relief. If by that point there isn't, then they can go up maybe by 50% or double the dosage, somewhere around there, and see if that works better for them. Again, keeping that journal and documenting their journey the entire time to be sure and notice any subtle effects that may have helped them. And the final question that you should ask yourself if CBD did not help you is whether or not you took the right delivery mechanism, meaning did you take it sublingually or under the tongue, or did you vape it, or do CBD cigarettes? And both of those I don't really suggest, only because of the fact that the American Lung Association states that anything that is inhaled essentially can cause lung damage. And it also works for a very short period of time. And again, I'll link the videos above and below as to the video that I did basically detailing the delivery mechanism and how you should introduce CBD to your body and considerations that you may want to take before doing so. But also, you know, just real quick, talking about if you took gummies or capsules and things like that. Well, did you take a consistent fatty meal with it? Because the name of the game with CBD is to basically have as consistent of a steady state plasma level of CBD within your system to work with your body's own endocannabinoid system and help with your body's own cannabis molecules such as anandamide or 2-AG that I've talked about before. And whether or not you took it with a fatty meal, and the amount of the fatty meal that you took can affect the absorption rate in your gut by anywhere from 4 to 14 times as much. And so you get these big booming kind of peaks and troughs in the plasma level of CBD, and that's not really what you want to go for. You really want to go for a slow and consistent state, which is why I always suggest sublingually under the tongue, where you hold it there for at least 60 seconds so that it can absorb over time, and that gives you good consistent dosing. So just real quick, I know I said that I would talk about only top 5, but when I was editing the video and just kept thinking, I can't believe I've almost left out the different spectrums, like broad spectrum versus isolate or full spectrum. And so this is very important to talk about. Full spectrum means that it takes full advantage of the entourage effect, meaning that the whole plant is more than the sum of its parts. And so it creates this synergistic effect. And full spectrum is the more ideal way to go about it. There are little nuances as to why you may want to take one, like say full spectrum versus a CBD isolate. The broad spectrum kind of removes the THC, and then the isolate is just CBD isolate. And again, if you want to know more about this, I'll link the video where I take a deeper dive on this. I'm sorry, I just can't cover everything on one video. So this is more of a very general discussion. If you originally just started off trying CBD isolate and didn't work very well for you, and if your employee allows, then consider trying the full spectrum because it has a wider therapeutic window. So that concludes this video. I hope this content was helpful for you, and I would appreciate smashing that like button as well as clicking the subscribe button so that you can stay tuned to my future content. And if you did find this valuable, please feel free to share it with others. Comment down below about your experiences and anything that you may want to add, as well as if you have any requests for videos too, be sure and let me know. I'm very good about responding to comments, and I post weekly, typically on a weekend at the very least. And so until next time, take care, stay safe, bye-bye, Pura Vida. It was... Excuse me.